Now, each of these questions covered in this video covers things like time frames, herbs, diet, mental health, why you're stuck, test, genetic, and some more things as well. So let's get into the questions in this video. So first question, how long will it take to get better? How long might it take to see improvements in my fatigue levels? Common question. Now, this is a tough one because really everyone's at a different stage, severity, age, we're all different, right? The simplest was to give the answer would be, well, how long have you had the health condition for? That's a good idea to think about. If you've only just started having the symptoms in the past month, or you've just had it in a few days, it's going to be faster, obviously, to recover. If it's chronic and you've had it for like 10 years or something, it's going to take some time to peel back the layers, like the layers of an onion, to achieve healing results permanently. Furthermore, consider compounding factors like if you've got a healthy BMI and you eat clean and you sleep 8 hours of unbroken sleep a night, and you're only 30 years old, it's obviously going to be much faster. But if you're obese and you're suffering chronic inflammation and you eat candy every day and you drink cola, you get the picture. It's going to take much longer to get results. So I wish it was simple, but there's a few factors there to give you the answer for you. Next question, why me? I eat so well, exercise regularly. This one I actually get a lot, especially when you're really rock bottom, you're in so much pain and it's debilitating. It's not just you, and everyone has some kind of health challenge in our lives. When you're feeling that though, it seems like it's only just you. Although you might see others around you looking healthy and they're actually having some health challenges, or they will in the future. It might not be that specific thing, it might be something different. It might be cardio or mental health or depression or cancer, but we all get health challenges. So try to understand that if you can. Furthermore, it's a complex combo of epigenetics, social and geographic factors, diet, stress. For example, there are some twin studies like the Scott Kelly and Mark Kelly study with NASA. Now, Scott's gene expression was proven to be 7% more of an impact. Gut microbiome, eye shape, inflammation. And there's also another twin study, the Mistral, Minnesota study of twin reared apart study. And that shows you that it's much more complex than a simple answer of why just you. You're going to get there with the right support. Next question, will I have to stop taking my current pharmaceutical medicine if I start naturopathic holistic treatment with herbs, diet changes, and therapeutic nutrition? Short answer, no. Best to keep everything the same. And then if you know things are changing, you know what's working. If you change it, too many things are changing. Also, you might have side effects of withdrawing from those pharmaceuticals. So don't stop them. Keep them going and then add some holistic approaches like diet or herbs. That's the safest way and the best way for you to see what's improving. Next question, are there any interactions between herbal supplements and the medications I'm on? Now, there's this important concept called pharmacokinetics or pharmacodynamics, which is how do the drugs and your body interact? What happens in your body and what happens to the drugs in your body? And there's also contraindications with those medicines as well. And this is why you see a professional to get the right recommendations and the personalized treatment for your recovery. Education's really important, and this means studying drug interactions and together with the herbs and the nutritional medicines. So medicines have this thing called LD50, lethal dose 50, like warfarin is a drug, and that's a very high LD50. And other ones like vitamin C, it's very safe. You can have like 11 grams per kilograms before you reach that LD50, lethal dose of 50%. Now your medications have a LD50 score, and some are safer and some are not, but that's what your practitioner is studied, and that's what they learnt, to safely give you those herbal preparations and nutritional supplements together and correctly and give you noticeable improvement without getting side effects and beneficial interactions, usually together with the medicine as well, meaning a better outcome in the end. Next question, why do you think my condition is getting worse despite all the treatments I've already tried? Now, I cannot know exactly what treatments you've tried and the things you've tried before, but I suspect you haven't found the right path to improvement. There are most likely a lot more possibilities available that you haven't tried to get improvements. I also often hear that holistic and personalized approaches surprise patients because they were never told that this approach before existed, and they never found that it was actually the answer until they tried it. Now, I've seen patients who tell me, how come I've never heard of these possible treatments before? It's really interesting to hear that, but a lot of things are out there that you're just not told. So that's a reason to get a second opinion, and don't believe everything your doctor has told you because it might not necessarily be correct. Our next question, can naturopathy, holistic approach, address the exhaustion that keeps making me question how much longer can I keep going like this? Oh, that's a tough question. I've seen this when patients over the last 20 years, they hit rock bottom, and it's really tough for me to hear. But yes, I know there are things that can help you. You're reaching out, you're wondering, what can I possibly do? And all I know is that absolutely, I love what I do and I see the potential and the power of a holistic approach. When I hear success stories, it keeps me motivated and keeps me wanting to help more and more people. And you know what? Personalized medicine really is the way of the future. And the public is waking up to this as well. Gone are the days of the cookie cutter approach to getting a pill and then going home and just take that, there's nothing more you can do. It's 2026. It's time to have all the help you deserve and live the best life you deserve as well. Now, next question. What lifestyle changes do you suggest for managing debilitating fatigue and long COVID autoimmunity or chronic fatigue? This one needs a personalized answer. Lifestyle involves everything from your drinking water to exercise to your curtains in your house or even clothes fabric. Hopefully you get the picture from me describing this and how diverse we all are. You might be living in Tasmania, for example, in Australia. Cold climate, you've got a home heated by a fireplace, or you might be living in northern Queensland where it's tropical, where you don't have to heat your home at all, but instead you might have a mold problem in that Queensland home because of the humidity. Very basically, for you watching this video, the advice I would give you is movement is essential and non-negotiable. If you can only walk to the letterbox, do it daily. If you can start exercising at a class in your local area, do that. Secondly, clean water. Are you hydrated enough? And thirdly, earth grounding daily and sunlight daily. Walk barefooted and enjoy direct sunlight on your skin every day. Those three are non-negotiable for everyone living anywhere on the planet for optimal health and energy and immunity. And next question, how do you determine the underlying cause of fatigue, long COVID, autoimmunity? Information and careful case taking is the starting point. My first consultations are 60 minutes and they cover everything from sleep patterns to diet to clothing, all of that stuff, and to the current supplements as well and medications. Unfortunately, general doctors or emergency departments, they don't have time to listen to your whole picture of your history, your life, all areas of your health condition. Now, I always hear particular points that stand out and key focus areas when I'm with patients and I listen to their story of how they got sick. An example could be a mine worker who lives in northern Western Australia, working in an underground mine, exposed to dust, who developed their health problem 2 months just after starting that job, for example. Or during a consultation, hearing the history of antibiotic prescription for ongoing chronic chest infections over the past 10 years. So the underlying causes sometimes overlap for all patients, like there's similarities with some things, but usually there's a specific trigger or component for each patient. That's what makes you individual, and that makes it clear for your case and what's going to help you specifically. Next question, have you treated other patients with similar autoimmune fatigue issues, and what were their outcomes? The answer is yes, I can. I have passion to help people who are struggling with this. And I think about the same question to any specialist. Ask a dentist, for example, have you ever helped someone with a toothache? Did you help them? The answer would be yes. Some toothaches were more difficult to help, and the dentist helps all patients with toothaches. The difference between a good practitioner and a not so good practitioner is their personal experience, which gives them empathy plus experience to help a variety of patients. I've been helping patients for more than 20 years, as I said, and I couldn't imagine doing anything else. Love it and help lots of patients. Next question, how often would I need to see you for a consultation? This question ties into how long does it take to get better, really. In an ideal world, every 2 weeks, and you want to get better as fast as possible, but seeing in a consult every 2 weeks is great. Check in because I want to help you keep accountable and keep your motivation high and keep making tweaks and beneficial changes for symptoms to change. The worst thing is to stop attending your consults or keep working on your health yourself because you lose hope. It upsets me sometimes when I hear a patient say something they didn't get in touch because of a small thing that was an easy fix, like, oh, the medicine tastes horrible, the herbs taste horrible. I just say, oh, we'll mix it with juice, or maybe just take it in a different time of the day and a little tweak. And then I say, oh, wow, that was easy. And then they start to recover faster. So keep with it, motivated. Our next question, can stress or emotional factors be contributing to my fatigue? And how would you address that? Well, that one's simple, 110%. Stress in the world versus local environment. There's work, there's family, there's lots. Definitely stress is a big factor. Now, patients off the chart stress, they're going to have a harder time. And like an exercise addict as well can give you stress. It doesn't have to be emotional stress, it could be physical stress as well. Reduce that. Sleep hygiene is important for the stress, and herbal medicine and adaptogens are great for managing stress. Sometimes I need to refer on, but holistic approach to give you the right plan there with herbs and lifestyle. Next question, how do you monitor progress in naturopathic care compared to blood tests from a doctor? Well, actually the answer to that is I use a lot of the both, but I also use functional testing as well with questionnaires, consultation monitoring and questions in there, associated symptoms like digestion, for example. An example with anxiety, you could have diarrhea as opposed to a formed stool with time. So monitoring those particular body signs is a great way to monitor progress. What role does gut health play in autoimmunity fatigue, and how can we improve it? Always gut microbiome health plays a part. The microbiome health and diversity is essential to health. Like intestinal hyperpermeability, also known as leaky gut, big part because those toxins are crossing the blood microbiome and the villi and entering into the bloodstream. Like, for example, opportunistic bacteria, Enterococcus galianum, that's contributed also to autoimmune conditions because it crosses those microvilli. Gut health, microbiome, super important. Next question, do I have to change my diet? Is there a diet plan that could help reduce my symptoms? Short answer is not really. I don't make you change anything. It's up to you to do the changing. I guide you and make educated suggestions, which evidence supports those things, and you get the improvements by doing those. So you don't have to do anything, but definitely there are certain eating patterns that will give you improvements, and I'll guide you through those. Generally, I gauge what are you willing and what are you able to do in your situation, and then I give you those suggestions. Someone might be able to do much more and they're just fully committed to completely overhaul the diet, then I'll give you that. Next question, do I need to get more tests? You might have already had enough of tests and spent enough money in it. I can review those and we can repeat specific ones if necessary. Some patients love analytical data and they love that approach and facts and figures, and others not. It's really up to you, but it does help with that data to help me. I have to factor in your financial situation, your cost, and also the data of how important it is for you to fully recover. So we'll discuss what's the best way. Are some tests non-negotiable, or can we just use what you've got to navigate through and get you the results? The next question is, how can a naturopath help me with my long COVID fatigue, my autoimmunity, when specialists like immunologists, they haven't been able to so far? It's a great question because those specialists, they're experts, right? They're trained to specialize in that particular area. So unfortunately, they're not trained in an holistic approach, and this is where they fall down. So they're really finite, looking at a particular area of your health and your condition, and they're missing all this opportunity. Also, they're prescribing specific pharmaceuticals only, pharmaceutical based. And when was the last time you heard them tell you, oh, have you tried this detailed diet plan? You know, time is short in that consult, and it's not an individual plan, but rather it's a one-size-fits-all cookie-cutter approach, unfortunately. So I would say that's where the specialists haven't been able to help you, and a holistic approach will help you. Now, next question, are there any natural treatments or herbs that can specifically target the root cause of my condition? I love that question. Finding the root cause is quite key to overcoming these health conditions. Now, there are herbs and natural treatments for everything, really. Firstly, herbs are classed as having specific actions on the body. Some herbs, for example, are sedatives and relaxatives, and they work on relaxing the nervous system. Others, like laxatives, they're obviously working on the digestive system. Now, each herb has different classes. Now, with autoimmunity, we have modulators as well. I also work with a microbiome, which involves testing diet microorganisms like probiotics. Then there are lifestyle strategies like breath work, sleep hygiene, accountability with goal keeping as well. There are hyperbaric chambers, DMSO creams, nutritional medicines, supportive biochemistry with nutrition on a cellular level. There's deep detoxing protocols to remove heavy metals too, and the list goes on and on. You get it. It's really, there's so many factors in it, and it really depends on the patient and you and the direction, the treatment path, which treatment path goes in which direction. So be sure to book a consult via the link in the description for your personal treatment plan. If you want to get into your specific plan, or if you want to go deeper, then just keep watching this video right here.